Hey everyone, welcome to Support Guide. Quick question, does it ever feel like Medicare just keeps getting more confusing every year? If so, you're definitely not alone, and that's exactly why we're here today. My goal is to break down the 2025 Medicare changes into simple, clear points so you can stay informed without feeling overwhelmed. We'll look at rising costs, updates to coverage, and some helpful tips to make sure you're prepared. So then, let's start with costs, because that's what most people are worried about. Healthcare expenses are already a huge concern for many of us, and unfortunately, Medicare premiums and deductibles are going up again next year. It's frustrating, especially when those COLA increases seem to vanish under higher medical costs. Let's break it down. Medicare Part A, which is mainly for hospital care, will see the deductible increase from $1,632 to $1,676. For hospital stays longer than 60 days, the daily cost rises to $419 from $408. And after 90 days? Medicare coverage ends altogether. Then there's Part B, which handles doctor visits and outpatient care. The monthly premium is going up by about $10, landing at $184.79. The deductible is also rising slightly, from $240 to $257. While it's not a massive jump, every dollar adds up when budgets are already tight. Keep an eye on your mailbox. Medicare will send you a letter in December with your updated costs for 2025. Now, if you're feeling overwhelmed by these changes, don't worry just yet. There's a program that could help with out-of-pocket expenses, and I'll share more about it in a moment. But first, let's talk about another important update, Medicare's payment rates to doctors. Here's the surprising part. While Medicare is charging more for coverage, it's reducing how much it pays doctors by 2.93% in 2025. This is because a temporary funding boost is expiring, and Congress hasn't approved any new increases. While this change shouldn't directly affect you, some worry it might make it harder to find doctors who accept Medicare, or that appointment times might shrink as providers try to make up the difference. Let's hope that doesn't happen, but now you'll know why if it does. Next, let's talk about telehealth. I know many of you have come to rely on telehealth services during the pandemic. It's been such a convenient way to connect with doctors. Unfortunately, Medicare is tightening the rules around telehealth. While it's not going away entirely, there will be new restrictions on where and how it can be used. On the bright side, certain services, like counseling and caregiving support, will still be covered. And if you don't have access to video, some services will still be available through a simple phone call. It's a mixed bag, but it's important to plan for these changes. Now, for some encouraging news, Medicare is expanding coverage in specific areas. For example, they're introducing new payment options for FDA-approved digital mental health devices, which could improve access to mental health care. They're also starting to cover some dental services when they're directly tied to other medical conditions, like dialysis. It's a small step forward, but it shows that Medicare is recognizing how important dental health is to overall well-being. And before we wrap up, let's talk about a program that could really help many of you, the Qualified Medicare Beneficiary, QMB, program. If you qualify, this program can cover most of your out-of-pocket Medicare expenses, including premiums, deductibles, and co-pays. The problem is, only about half of eligible people are enrolled. To qualify, you need to meet income and asset limits. For 2024, the monthly income limits are $1,275 for individuals and $1,724 for couples. These limits may change in 2025, so make sure to check with your state's Medicaid office for the most up-to-date information. Then once you're enrolled, let your medical providers know, as federal law prohibits them from billing QMB participants for Medicare costs. Unfortunately, mistakes still happen, so if you get a bill you shouldn't owe, speak up. Providers and debt collectors can face penalties for trying to collect from QMB recipients, and you may even be entitled to a refund if you've paid something in error. Lastly, a quick heads up about scams. Medicare will never call you out of the blue to ask for your Medicare number or bank account information. If you get a suspicious call, hang up and report it to them. Stay vigilant and keep your information safe. That's all for today. If this video was helpful, please don't forget to give it a thumbs up, subscribe for more updates, and share it with anyone who might need this information. Thanks for watching, and I'll catch you in the next video on Support Guide.